We now,
Sorry, go ahead.
yeah, thank you. We also found that communications were very important, and more specifically around being included in decisions that affected their jobs. That was a very important part of job satisfaction. One of the most compelling areas of concern for the DSPs was how much support they get from their supervisor. It was really important to them to feel supported by those to whom they reported. And that came out in both the surveys as well as in our focus groups. We also asked respondents how likely they were to recommend working at Koinonia. And we found this to be a very strong score for the organization. And again, very interesting to us because the turnover issue is there, but people would still recommend working at Koinonia. So we had to ask ourselves what is really happening there and within that particular response. And we dug a little bit deeper in our focus groups around that issue.
Thank you. To our audience, we realized that we were having a little bit of a communication issue with our broadcast. You could see the slides, but you weren't hearing the audio. So for your benefit, we're going to keep moving on, but after the webinar is over, we are going to go through the beginning slides again that we may have missed or that you may have missed so that they're captured in our recording. So Diana Rosa, I'm going to ask you to talk about the next couple of slides and what were some of the findings that you saw with relationships with coworkers?
Okay, when we did our original online survey, some themes, kind of developed, and some that we weren't surprised at that were important to our DSPs. Those were the questions we were asking, were of course wages and benefits. So knowing wages and benefits was something we're going to have to try to impact anyway. We wanted to dig a little bit deeper and really find out what was important, to our DSPs in helping them to want to remain at the organization or what kept them at the organization. So we took the next few things, which was relationships with their coworkers, relationships with their supervisors, opportunities for growth and development and recognition. Those are things that they called out as being important to them. And we pulled those out and did another survey to really have them rank how did they feel about each one of these things and importance. And in the first one, in relationship with coworkers, again, the 1, 2, 3, and 4 symbolizes 1 means that this is very important to me, 2 is ranked next, 3, and 4 is being least important. And you can see it was kind of an even distribution, so a relationship with their coworkers, depending on who you were asking, was important or not important, but it was kind of easily, evenly played. Then the next one, the next slide.
I received recognition, yeah.
Yeah, recognition for a job well done. You can see that was, that surprised me that, when compared to the other areas, recognition for a job well done was not as important to our DSPs as their relationships. And then the next one, which is opportunities for growth and development. Yeah, opportunities for growth and development, again, very even, didn't necessarily stand out as one that was more important to some than others. But you can see everyone, saw some importance of it, but it didn't really, resonate as much. And then our last one, which was their relationship with their supervisor. Now that's one that you can see became very important to them. So that is the one that we saw really, really rise to the top as being important and a factor that really, really kept a person at the job is how well that they related to and received support from their supervisor.
Great. And then the next one, and the last slide like this, Diana, is how likely are you to recommend working at Koinonia to a friend or colleague? Would you mind discussing the results from that as well?
And the results from that, we were really happy to see that many of our staff are not unhappy, working at Koinonia. So our retention, or sometimes when we have issues with retention, it's not about how much they love or did not love working at the organization, because we receive very positive responses, to this one question. And I will add that we've done other surveys since then, and we continue to find the same thing. When we ask our staff about how happy they are working at our organization, they are all, compared to a lot of organizations, very happy. Think Koinonia is a great and quality place to work for. So that also, really brought to mind that them being happy or not happy at our organization was not necessarily a factor, because most of our DSPs do like their jobs and like working at Koinonia.
Dr. Hewitt, how do those results kind of reflect the feelings across the country? Do you think in general?
They're very consistent with other studies that have been done. And one of the things that I've always said is that half of the workforce is highly committed to this work. They want to stay in this work, and they will stay in the work if they're nurtured and supported. And so what the data that was just shared on the past few slides tell me is that they feel supported, and that it is a place of employment that they would recommend to their colleagues. And so while it's not surprising, I think it's positive findings, and the goal is to get all employees to stay long enough that they can have those connections and feel that commitment to the organization enough that they would recommend others to come work for Koinonia.
Great, thank you. Dr. McNally, would you mind reviewing the prevailing themes that came out of the focus groups with our audience?
The focus groups, from my experience in this study, were the most compelling in terms of the feedback and the specificity of feedback that we received. We were really able to have a robust conversation with the DSPs and bringing their voice into the project. The prevailing themes you see listed here really focus on their experience within their work groups and relationships. Specifically with the first item here, the work ethic with new hires, there was a lot of concern across the DSP focus groups that new hires are coming into the organization, perhaps not always understanding expectations, maybe not being trained, maybe not receiving the supervisory guidance that they need to really make the contributions that maybe some of the longer service employees make. We already knew that pay was very low. We had a lot of conversations about pay. A couple of comments that really resonated for me was that this is the hardest job you'll ever love, and you're going to love doing this work, but the pay is low, and you really have to make decisions about supporting your family and how you're going to, continue to be viable from a financial perspective. So even though they love their jobs, they did have a lot of concern about their financial viability. They were concerned sometimes about supervisory support, specifically around favoritism. They really enjoy being together as a group. They like building relationships. They want to have that network of support, extremely important to them. The stress of daily living is another issue that came out in our discussions with the DSPs, that the DSP job experience, the schedules, the way in which the day flows, people call off, can really cause a lot of stress and disruption in their lives, and it's hard on their families, and those are very important issues for them. One of our participants told us that she gets up at 3 in the morning to get her child ready to go to daycare, and then she comes and works a 12-hour shift and then goes home to get the child ready, for the evening. And that's a day in and day out, sometimes 6 days a week experience for this particular employee. And I think that was, an example of what the stress levels and the concerns with the impact on family. There was a high interest and need for visibility with the senior management of the organization. The DSPs really would welcome them to be part of the workplace and their local work sites and see them more often. I think the most compelling reason DSPs stay at Koinonia is because they love their clients. They really believe they make an impact on people's lives, and their clients would be very sad to have the DSPs leave. And there was a lot of conversation around that impact and why that is so important to them. They really felt that it was a great place to work. They love the Koinonia way. They feel that Koinonia is a well-intentioned company. They just would like to have more voice in how their jobs, in their jobs, and decision making around their jobs, and really want Koinonia to do a better job of hiring and training the right people for the DSP role.
Thank you. Dr. Hewitt, what were your impressions of the focus group comments?
My first impression was how important it was to get the DSP voice. That is often something that's significantly lacking when organizations are making decisions or policymakers are making decisions. Often it is not the voice of the DSP, it's the voice of the organization, whether that's human resources or the chief executive officer. So the fact that these themes evolved from what workers were saying is really powerful to me. One of my priorities right now in my work is really trying to get DSP stories from their perspective, not filtered through a big legislative initiative that a provider trade association's doing, not filtered through a CEO of an organization, but really teaching DSPs how to shape their story and tell their story, because they're so powerful. And I just believe that if people in our communities understood the high skill that's needed, the stress, all of the realities of living on the wages and with the benefits that DSPs face, we'd see a lot more movement than we do when those messages are coming from organizations. So I applaud this effort to get their voices and then to match interventions to what they saw as the most significant challenges.
Thank you. Dr. McNally, could you talk a little bit about the external benchmarking that we did as part of the study?
Yes, we took a look at a number of sources for external benchmarking, both in existing research, and we did our own benchmarking, called a number of organizations to explore some of their current practices. We focused on wages. We did a wage scan of the recruiting radius for Koinonia. And when we were doing our own benchmarking, we also looked into the supervision practices, how organizations communicate with their particular DSP workforce. What does training and development look like? We asked a lot about how people are onboarded and trained, and how training continues to happen across DSP's work life, and also recruiting practices. This was a very interesting area for us because of the current conditions in the labor market. So we wanted to be sure we had current and refreshed information around recruiting.
Thank you. And then in our next slide, we're taking a look at what the wage situation is like here in Northeast Ohio. Dr. McNally, maybe you could talk to that for a few moments.
Yes, we wanted to put some type of a milepost in terms of when we're talking about wages, what are we talking about from a starting point? So we looked at Cuyahoga County, which is the surrounding area in Northeast Ohio from which Koinonia generally recruits from for the DSP population. And in looking at the reference point for wages, we learned that the living wage in Cuyahoga County is $10.77 an hour. So that helped us understand our reference point for doing our benchmarking around the wage issue.
Thank you. And Dr. Hewitt, how do wages in Northeast Ohio compare to wages around the country?
In this field, they're reasonably consistent. You know, there's not in the occupational area of direct support, there's only about a $1.50, $2 an hour range that we see across the nation. And you would think that there are much more significant regional differences than it really plays out. In a number of our studies that we've done statewide in states, we just made assumptions that there are big differences in what workers are paid in this field, but there aren't. While the prevailing wage in those regions might be very different, the wages for direct support professionals tend to hover right around that $11 an hour, $12 an hour range. So there's nothing inconsistent in the findings, and it's just really important that the organization is always staying on top of what's that prevailing wage in the geographic areas in which we deliver services, not just in the field, but more importantly outside of the field. And that's where those DSP stories are so important, to be able to say, well, here's the skill set you need to have to work at Costco or to work at Amazon or Walmart or Starbucks or any of these places. Here's what you get paid, but look at the skills that I have to have in order to support people with disabilities, and this is what I'm getting paid. And that skill differential really needs to be the basis of our argument around wages.
Thank you. Dr. McNally, maybe you could talk to us next about the organizational practices and the benchmarking that was part of the themes of the study.
Certainly. Our organizational practices benchmarking asked a lot of questions around how organizations are attracting and retaining DSPs, and we really wanted to look at how they're addressing things like communication and culture and support for that population. One of the overarching themes for combating high turnover in general is to really create a mission critical status for the DSP position. And this really means aligning resources around the DSP and really enriching all of those resources that impact hiring, training, rewards, and pay, and therefore reflecting the high value that job brings to the organization, and also that that's really responsive to the scarcity of talent around this. Other organizations that experience high turnover in other industries have adopted these models of mission critical status for particular jobs in their organizations, whether it might be a bank teller, it might be a housekeeper within a hospitality organization. They have repositioned their resources where those become client-facing and mission-critical. So it's a very interesting and important practice that we see emerging in the market. Creating a culture of belonging and value. This is an area where really building a consistent and relevant and meaningful communication strategy to be sure that it's constant interaction with the DSPs to help them feel attached to the organization, that someone cares that they're there, that they understand why they're there and the value that they bring. So really to galvanize that affinity for the DSP and the organization. We also find that creating centers of support for the DSPs is very, very important. And this is true for any employee, is really to make sure an employee feels supported within the organization, that there is a proactive effort to address issues that they have, that they're not just a crisis at every moment because no one was anticipating a person's needs or being able to rapidly respond to the changing needs of the workforce. So to really create those centers of support and wrap those services and support around the employee is important to minimize disruption and to help employees manage the stress of life and work life.
Great, thank you. Dr. Hewitt, any comments on this slide?
I think all of these really speak to organizational culture. And while we know wages and benefits really are a predictor of turnover, we also know how important organizational culture is. And so it's exciting to see an organization that's so focused on trying to develop interventions around organizational culture, because many just focus on wages, benefits, and in some cases kind of levels of position to increase wages. But the way in which people feel a part of and belong to an organization and connect with its mission and its values is just critical.
Thank you. And that's a good lead into talking about our organizational here at Koinonia, something called the Koinonia Way. And I'm going to ask Diana Rosa to explain that to our audience.
Okay, the Koinonia Way is the philosophy that we have adopted in our organization. And we call it the Koinonia Way because it really is about the way we do our day-to-day. We understood that the only way we were really going to impact retention and make changes in the lives of our DSPs and our staff is to really couple all of these initiatives with a really good culture. So building out the Koinonia Way was a way for us to really spell out what our culture is, which is creating a collaborative environment that really empowers and motivates people to do their best every day. So this philosophy is wrapped around not just our staff, but also how we interact with our individuals. It's like we see ourselves as a community of people really supporting each other. So we wrapped it around 3 areas: care, support, and lead. So care really speaks to that we really care about our employees, we really care about our individuals, and we really want to promote behaviors that build a caring environment where people feel safe, physically, psychologically, and socially. We have a trauma-informed response, and we're actually doing another study from other grant funding to really build that type of environment. Person-centered support. So person-centered is not just for our individuals, but it's also for the staff that we interact with. Support, that is looking deeply at our career development, providing career paths for our staff, making sure that they can see themselves on a career path is particularly important for our DSPs. And then lead. So lead really gets into, we can't do this if we don't have leadership in the organization. And the one thing I love about Koinonia is when we talk about leadership, it's everyone in the organization is a leader, because the behaviors of every single person in the organization really impacts, how we interact with each other and the experiences of everyone. So we've outlined 10 leadership behaviors that we ask everyone to exemplify based on the study, really showing that relationship with the supervisor is so important. And me heading up organizational learning, my team has really put a huge influence and impact on leadership training. So we call it Leading the Koinonia Way, where we don't just expect people to read our 10 leadership behaviors. We're really teaching people and giving them the tools to actually, live it. Also in lead, we're doing things like change management to make change easier for our staff. We teach situational leadership. So behind each one of these circles in this Venn diagram, behind it is research, behind it are studies. We're collecting data and really trying to be able to measure how we're making an impact. So the Koinonia Way is something that people see embedded in everything that we do. We bring it up in how we interact with each other, every single day. So this is really the foundation of everything that we're doing.
Thank you so much. So now's the part time that our audience has been waiting for very patiently. We're going to start talking about the recommendations and action plans from the study. And Dr. McNally, I'm going to ask you to kick this off.
Yes, we have a number of recommendations, and I will go through the recommendations, and the action plans have been put in place in many of these, and as you can see, the timelines are already in motion. But specifically looking at our recommendations, the first one here is to really cultivate, for the team to really cultivate 1 or 2 deep and sustainable relationships with organizations and educational institutions that can provide candidates for future DSP positions. And this really would involve creating co-ops and other training opportunities, perhaps some type of academic sponsorship for students, but really be a ongoing and very present part of the educational institution where students really think of Koinonia first when they're looking for their first career opportunity in the DSP role. Creating success profiles we feel is very important, where in which you articulate key competencies that make DSPs successful, and utilizing those profiles when you're assessing and selecting talent. These are extremely effective in helping to select the right people into the organization and to select those who have the highest probability of success and longevity in the role. So that takes time to do an assessment, understand what's important in the role, and then creating selection tools and onboarding and training tools to support successful DSPs. Realistic job previews Koinonia has been using this approach for a long time and really trying to create day in the life scenarios for individuals considering DSP as a career or coming to the organization as a candidate. This really allows them to see what is the job really like, and we're recommending that we refresh and renew and enrich those day in the life scenarios so they can really get an up-to-the-minute, very close look at what the job is really like. We also recommend making the previews part of the pre-selection process so people get an early look at what the job is all about. We also highly recommend building employee referral programs that are very targeted to the communities in which DSPs live and their social circles. There's a referral program in place, but we recommend really targeting the specific communities that the DSPs can reach into and draw from in terms of referring viable candidates for the positions at Koinonia.
Thank you. Dr. Hewitt, any comments on the recommendations on the slide?
I think the one thing I would say is these are all solid recommendations that have evidence base behind them. They're ones that when we're working with organizations, we often recommend. And the other piece of kind of my reaction is one of the things that's so important for organizations to do is to be very planful and strategic about when and how they implement these interventions, and to make sure that they have a solid evaluation component to their implementation so they can really know if what they're doing, if you implement everything all at once and don't have a well-designed evaluation, then it's hard to pinpoint which of them was effective and which of them was not.
I think that's very good advice that our Chief Quality Officer would agree with you on. So some more recommendations here, Dr. McNally, for you to go through.
I mentioned earlier about the mission critical aspect of the DSP role and really creating a support around the role and resourcing that role to professionalize that job within the organization, and that is around selection process, competency identification, performance expectations, development and training, all of that really enriching all of those resources around the DSP where they can feel that they are of high value, there's a reason to stay, that they're recognized for the value that they bring to the organization. Very important strategic approach to the DSP retention strategy. Providing well-being days. There was a lot of conversation around, stress and burnout. What we discovered was we didn't need to necessarily add days to the paid time off, rather to encourage the DSPs to take the time they already have. That was something that we discovered was perhaps not happening on a consistent basis. So to have supervisors really recognize when one of the staff needs time away to, just to decompress and, regain their energy for the job. So that was something we were going to focus on with the supervisors in particular. Implementing quarterly stay bonuses. This is an approach that has worked in other organizations where on a periodic basis, they award bonuses to folks who stay with the organization. They put some specific criteria around what that looks like and who might be eligible for that, but they're highly effective and we have recommended that be incorporated into the reward strategy at Koinonia.
Thank you. And Dr. Hewitt, your impressions on these recommendations?
I would just echo what I said on the prior ones. I do really think the well-being days is important. We increasingly hear from DSPs that there's so much pressure on them to show up every single day because there's such a staff shortage that it just adds pressure for them to work when they're sick or work when they just really have something in life that's hard for them. They just don't feel the freedom, and sometimes face retaliation from supervisors. So seeing that again, to me, with a real focus on burnout and stress is just an indication of an intention to actually support the workforce. So that's really good.
Thank you. And some more recommendations, Dr. Hewitt? I'm sorry, Dr. McNally?
Yes, the last few here focus. The first one focuses on supervisory training. Diana mentioned earlier about leading the Koinonia way is underway and showing good results, where really the organization is devoting resources to helping supervisors understand their role and be as effective as they can be. Retention coaches is another approach that the organization is considering. These are individuals who are designated support to support the DSP, where they regularly visit the work sites, interact individually with the DSPs to identify any areas of concern with the DSP, areas that might cause that individual to leave the organization, and try to address those things before the person actually exits. So this is really a very dedicated resource to help the DSP do the best that they can do in their jobs. And lastly is the stay interviews to get ahead of the exit issue, and not wait to do an exit interview, rather do a stay interview where you're speaking to people on a regular basis to find out what keeps them with the organization, as well as any issues that may put them at risk for leaving.
Thank you. Dr. Hewitt, have you seen retention coaches implemented anywhere before?
I've not heard those two words. We talk about it as peer mentoring, but that's the intention, is to have people in place to coach, mentor, support staff so that they don't leave, and to start that kind of early in the process of their employment. So it's a pretty common intervention that's used, though not used officially and formally in our industry much.
Thank you. And then some more recommendations for us, Dr. McNally, that you could please start.
Yes, we've also, in partnership with the retention coach role, is to have the coaches identify what we are calling engagement profiles for the DSPs, knowing what each individual DSP needs, what issues they may have, what their interests are in their careers, and really understanding on a person-to-person basis what will keep the individual in the organization, and then equip the retention coaches with what they need to help identify and address any issues that might occur. A DSP chat room is another recommendation. The organization has underway a way to reach out on a regular basis to creating an environment for feedback with the DSPs and leveraging technology to do that. We think that'll be a highly effective approach to continually engaging the DSP and also hearing their feedback on a regular basis. And that gets to that belonging and value need that the DSPs have. We talked about recognition and how we found a couple of different viewpoints on recognition. Although one of our surveys said that recognition wasn't all that important, what we found in the focus groups is that it is important, but it's important at what we refer to the local level, where the DSP is recognized in their peer group and their peers acknowledge their contributions, as well as the supervisors or management or leadership recognizing their contributions. So that was a very important distinction that we discovered in this study, that to have your peers hear about your accomplishments and your contributions is very meaningful to the DSP. We've also encouraged the organization to establish leadership rounds for visiting sites and engaging staff. That is underway, and it is very meaningful to the staff to see leaders on an informal basis coming to their work sites and showing interest in the work that they do.
Wonderful, thank you. I'm going to try to put Diana Rosa on the spot. So Diana, hopefully you can unmute yourself to talk a little bit about the eye care program, because we're talking about that a couple of times throughout the presentation. I was wondering if you could maybe explain it to our audience.
Okay, so our eye care program is what we call our eye care advisory team, and the eye care comes from our values, which are connected to the Koinonia way, actually spell eye care. So we have inclusion, compassion, accountability, respect, and exemplary service. And so this eye care team, and actually I now have two of them. So the first eye care team is a team of people who are not supervisors. So we have DSPs and other non-supervisory staff in this group, and we use Microsoft Teams. And I actually use this group to kind of vet things that we are that are coming out of the organization. It's a two-way conversation. They can also put things out there that they think we need to take a look at. I have actually put out 5 or 6 things that they have really changed the direction on, like how we do all staff. They have been having very candid conversations with me around our around vacancies, scheduling, anything we can think of. We are piloting a new intranet, and they are joining in with piloting that and giving feedback on that. So we have found this so useful because there have been at least 3 initiatives that we were ready, just to roll out. And when we got the feedback, it totally changed the direction. They know that they have the ear of the executive team. They have the ear of our CEO, because everything that comes out of that, again, I don't share names or things. I share themes coming out of it. I do all kinds of surveys with them, and I take those things directly to Diane, our CEO, and we really listen and we really act on those things, and I have found it to be very effective. The other eye care team, based on demand that I am now putting together, is the supervisors have now asked that they have their own eye care team, and so I'm pulling that together, and actually that's going to be starting week after next. And because they also see the value of that and want to be able to have a voice in doing that. The other part of our eye care program is what we call our CEO roundtables. And this allows everyone from every level of the organization in their own kind of cohort groups. So we have managers, supervisors, DSPs, all have their own groups, and they get to come have lunch with Diane, our CEO, and it's a very private group. It's meaning that they don't share anything outside the group. Diane comes out, she shares themes, but people now know that they have direct access to our CEO to really talk about their experience, and good or bad, so that we can implement and do things about it, and hearing from them firsthand. So it's been very effective. So effective, again, one group, their turn wasn't until April, and they came to me and said, we need to see her sooner. And we did, and we just put a group together, and we had 20 or so of our supervisors show up and really give us great feedback about things that we can do to impact the culture. So we call this leading from the inside, letting our staff guide us as to how we should lead and what they need, as opposed from our leadership coming from the top down. And people are really coming to my office and telling me that they love this change. They love the feel of this, having this voice. And it's very important to them. And I have a lot of people, jumping on my eye care group and really coming to those CEO roundtables. So it's been a very exciting time.
Thank you. I appreciate you sharing that kind of on the spot. And then we have just one more slide of recommendations I'm going to ask Dr. McNally to walk us through.
We encourage development days to help the team focus on skill and team building. We encourage a cohort setting. We learned a lot about how meaningful it is for the DSPs to be together, not just informally, but also in more formal settings and learning sessions. So we identified the need to do specific development days where the DSP can look forward to and plan for time where they're developing their skills as a team. Lastly, this is a longer term strategy and one that the organization is considering to sponsor a study to really look at the viability of a Koinonia branded DSP credentialing program. Currently, the organization has a career pathing pilot underway, and that pilot program will help inform the organization about the whole idea of credentialing and the importance of it and the impact, if any, on the DSP retention and turnover concern. So that's a little bit further down the road, but definitely something that Koinonia is well positioned to take on if they feel it has high impact on their workforce.
Thank you. And Dr. Hewitt, I don't mean to overlook you. Is there any comments that you want to make on any of the recommendations or action plans that we presented today?
Nothing further, thanks.
And Diane McNally, you did a really great job of something that we all appreciated here when you presented these studies to us. You tied them into the Koinonia way, and I'm going to ask you to walk through that with our audience.
Yes, I was delighted to have this framework available to really put an overlay of the DSP retention project and bring some clarity to it. It's a great alignment for the organization because they have all these other initiatives underway. And what I did here was to take the Koinonia framework, the care, lead, and support framework, and attach our recommendations to each area within the Koinonia way. So, for example, on the care element, really the idea of making the DSP job the mission critical, having mission critical status, and resourcing it accordingly. The well-being days, the retention coaches all fall into that area of care. As you see on the support side, that really speaks to some of the recommendations we made around cohort development, supervisory training, the peer-to-peer interactions, and so forth, really making that support system very clear and robust for the DSPs. And then leading, in the leading category here, really creating innovative pay programs, which are well underway at Koinonia now. Looking at your best practices in regard to recruiting, and as I mentioned earlier, the whole idea of credentialing and developing the DSP. So this was a very nice framework already in place, and it gave a lot of us an opportunity to really align our recommendations with some of the larger strategic initiatives underway at Koinonia.
Thank you. I'd like to take this opportunity to remind our audience that you can chat questions to any of our panelists or presenters today by using the chat feature on the side of your screen there. And before we move on to some questions to our panelists, I'd like to ask Dr. Hewitt and Dr. McNally to make any closing remarks to our audience.
This is Amy, and I would just like to congratulate the organization in the effort and the enthusiasm that I hear from its leadership in trying to address the issues. I think for those of you that are in the audience, the most important takeaway for you is that this isn't a organizational problem. This is a societal problem. It's a community problem. And Koinonia needs your help in finding solutions, and those solutions really, while there are things the organization can do to improve practices, it really comes down to elected officials. And so being their allies and advocating for change systemically, I think, is critical.
Great, thank you. Because we're a little slow on time, I am going to move right to audience questions. I'm getting quite a few questions in from the audience, and I see the first one's for you, Diane Beestrom. How has the study affected the way that you're personally doing your job this year?
I think the study was very beneficial in reminding me, and I think all of us, that the starting point really needs to be in conversations with direct support professionals, and we reviewed a couple ways that we've done that. I would say that I've appreciated their expression of their love for their job and wanting to do the job and wanting to do it well. And I think it's really important for us to make sure that we don't get in the way and that we look for ways to make that possible. So while we know workforce is a significant challenge, there are still things we can do while we advocate for practices and simplification of free policies and procedures to help alleviate some of the stress and burnout and advocate for higher wages, because nothing in this is suggesting that this will replace those initiatives. So it really gave us a lot of very specific, actionable next steps that we can take as an organization to work together with our direct support professionals and vetting things through them and with them to make sure that we're on point and the efforts that we're making are things that truly will make a difference for them.
Thank you. I think I'm going to give this question to our Chief People Officer, Julie Wagner. Julie, how has the study changed the way that we recruit for DSPs?
Wow, I think a real theme you keep hearing is the voice of the DSPs. And in 2019, we implemented a site visit as part of our interviewing application process so that the candidate can go out to the work site, meet the individuals, meet the employees there. And that's really important to us from an HR standpoint. We want to know how that candidate interacted with staff and individuals. We want feedback from the work site. Did the candidate just walk in, sit down on the couch, spend time on their phone, or were they really interacting with the individuals? This also helps us with fit, like an energy level of the DSP candidate, what homes or what work site might work best. We also have a very interesting project we started at the state level with Nick Miller. He is the DSP development specialist out of Director Davis's office of DODD. He's working with us on a project to get into some area universities to really speak to how the DSP role is mission critical for someone looking for a job if you're in college. Nick has a great story. He's a Bowling Green graduate, and for his entire 4 years during college, he was a DSP. And so he's working with us, working with Director Davis's office, getting in front of university classes. For students who may not think of DSP as a summer job or 4 years of employment, but really highlighting that this can really take you into, pretty far in your career versus retail or fast food. Being a DSP teaches you leadership, time management, critical thinking. If I'm a business major, that really speaks to me. If I'm an allied health major, that speaks to me. So just really trying to think out of the box with recruitment, but most importantly, too, collaborating recruitment with retention efforts. And again, that's listening to the voice of the DSPs, the supervisors, highlighting quality. One of our biggest referral sources will always be our employees. They know the position, they know the challenges, and they're going to refer good people to us too. So really benchmarking that, highlighting that, and improving on that.
Well, thank you, Julie. That's insightful. And then I'm going to ask this question to all of our panelists and presenters. What results do you think that we'll see a year from now, or do you hope that we'll see a year from now? And I'm going to start with you, Diana Rosa out there. What results do you think we'll see a year from now?
All right. So I guess you're starting with me because I'm the evaluation person. Well, yes. I am very happy that, through the Koinonia way and through other things that we're doing, that we are collecting some baseline data right now to hopefully see several impacts. And one is we really want to see an improvement in how we're living those leadership behaviors, really understanding that supervisory relationship is really key to our DSPs. So I hope to see an increase in that. And like I said, we've already, done a study or started collecting data on that. And that actually, the results of that initial survey will be coming out in the next few weeks. And we'll be using that as our baseline data into next year to look at how are we moving forward, with the Koinonia way. Is it impacting retention? We just rolled out also what we're calling our key performance indicator dashboard, that we are very closely looking at our incentives and things that we're putting in place in this action plan, and being able to make correlations to how they directly impact, retention and our turnover. And we just want to really be able to see an improvement of that, and an improvement in the experience of our DSPs, and them just really feeling like we have listened to them, and we're rolling out and doing things that are really making the experience that they have working at Koinonia better. And then that, to me, turns into retention.
Great. And Diane Beestrom, where do you hope to see the results take us a year from now?
Really emphasizing that we are really focused on the evaluation of our action plan and strategies. We've always tried a lot of different things that might make a difference, but I think we didn't have a strong evaluation to really know what is having an impact and what is not. So it helps us to be more focused with limited resources. And retention, we've said it over and over, is, if we don't always have at Koinonia a recruitment problem, but if as many people walk in the door as walk out the door, we really have a retention problem and a focus. So our focus is really on retention, and I'm hoping a year from now we're able to say that we have gotten a better and more intentional about how to impact retention. And I'm looking forward to us learning a lot about that over the year.
Thank you. We've come to the end of our hour. Panelists and presenters, if you could stay on the line, we've missed the recording of the first couple of slides, so I'd like to go back and re-record that before we end the webinar. But to our audience, I just want to say thank you so much for joining us. I know it's Friday and it's Valentine's Day, and you might have better things to do, but we had a really nice crowd join us today. I'd like to certainly thank Dr. Diane McNally for all of her work and for really partnering with us and coming to our all staff with her surveys and hanging in with us for the year. Dr. Amy Hewitt, I'd like to thank you for your participation as well as everything that you do for our industry, and it really touches all of us. And of course, from all of the panelists and all of us here at Koinonia, thank you for taking the time to listen to what we did, and please share your comments with us. If you have an idea or you want to take this conversation further, we would love to have the opportunity to speak with you. So thank you, everybody. And as I mentioned, if the panelists could just stay on board, we're just going to re-record a couple of slides at the beginning. All right, Dr. McNally, could you please go through the project introduction one more time for our audience?
Yes, the project that we focused on, as mentioned, was really the DSP turnover within that category. What is causing that turnover? What issues are creating disruption in that workforce, as well as with perhaps client service? The organization has made many efforts to combat turnover, and they have had some success with these efforts. But now they really want to dig deeper because they're very alert to the continuing labor shortage, particularly in the markets that they serve, and really looking at ways that they can proactively address turnover and retention to ensure appropriate levels of staffing. And lastly, the organization is very open to innovative ideas around retention and turnover. It is a learning organization, and they very much embrace new ideas. They like to test and learn from their ideas and adapt best practices, not only from within the industry, but outside the caregiving industry.
Thank you. And if you could talk a little bit about the research methodology that was used?
Yes, we did what we call a 360-degree look at the issue. We went externally and looked at existing research, both in studies and white papers that currently exist. We looked at other presentations and outcomes from consortiums around DSP staffing. We did a lot of internal research as well, using online and paper and pencil surveys. We conducted focus groups with the DSP workforce. And the areas that we looked at were around work environment, wages, relationships with coworkers, DSP training and their work schedules. And we were very interested in learning more about the day in the life of the DSP. And this is really what their experiences are working in this type of role on a day-to-day basis.
Thank you. And then those were the two slides that we missed before the recording, so we can officially end the webinar now. But Dr. Hewitt, any closing comments from you?
No, just keep up the good work.
Thank you. And thank you, everybody, for your time today. We really appreciate it, and have a great Friday.
Thanks, Cheryl. Take care.
Bye, everyone.
Thank you, Cheryl.